Tens of thousands of incarcerated North Carolinians sit in jail, often not receiving the mental health treatment they need. I'm Anita Brown-Graham. This is NC Impact.
NC Impact is made possible by funding from Civic Federal Credit Union and is a public media North Carolina production in association with the University of North Carolina School of Government.
North Carolina's local jail population holds more mental health patients than the state's mental health facilities. We found 5 counties that are bringing mental health services to jails. They're making sure folks receive the treatment they need.
After my playing days, I left the gym and I hurt my back. I don't actually know how I hurt my back, and I got prescribed opiates. It did something to me that I can't explain. I was physically addicted to the opiates. I've been diagnosed as bipolar. Most people who are, again, who has a mental illness, 3/4 of those people have a substance use problem, and I'm one of those people. Prior to getting clean, I was incarcerated at Pitt County Detention Center for 5 months. After my 5 months there, they asked me what I wanted to do, and I told them I wanted to go to a long-term treatment program. I went to a 2-year program in Durham, TROSA in Durham, where I found my purpose, and that's helping other people like myself.
The Stepping Up initiative was started by the National Association of Counties and also NAMI in 2015, and it gives us opportunities for counties to find ways to alleviate people with mental health issues and substance use issues that are nonviolent offenders, to try to keep them out of our jails and find them proper treatment.
What we've learned from our jail administrators in this 5-county region is that they see a lot of the same people over and again, and a lot of the same people that they see in our local jails are not necessarily hardened criminals. They might need to have health care attention, and that would better serve both them individually and the community.
Going on 6 years of sobriety, I made a decision, and I act on the decision. And if I hadn't have done it, I don't think I'd be alive today. I really don't. I get up every morning and I go to bed every night with gratitude. If you can save one life, we've done a lot.
The Stepping Up initiative sought to provide one-on-one sessions with psychologists for individuals in jail. No one was prepared for the volume of mental health needs they would uncover when they arrived.
Prior to video conferencing, we just went once a week and did a weekly clinic in jails. But it was clear that just once a week isn't enough for a jail, that often they will get a detainee in all of a sudden who's acting bizarrely, unstable in some way, and need an assessment much more quickly than waiting a week.
We've had some that come in here, we'd had to keep in a padded room. They were so bad. Since Dr. Coy has had several sessions with them, in their tenure here, we hadn't seen them back.
The inmates are now getting the treatment that they once weren't getting, and they're stable. We're able to manage them better, and the environment of the detention facility and wherever they may be is better.
When a person with mental illness comes into a jail, they're not going to get a therapeutic intervention from an officer. It's just not the officer's role.
Without medical records, we can't do much of anything. And so it is important that you have a psychiatrist that is able to identify issues with the inmates and then make a diagnosis and treatment.
We are a group of psychologists primarily, and our role is to address the needs of the client, the detainee that we see in the jail, and then ideally through this stepping up process, try and navigate a way for them to get out of the jail when they're in on a nuisance charge. That's the real effort, is to be able to navigate them out of a legal setting that's not really appropriate for them and a healthcare setting that is.
North Carolina's mental health leaders face a daunting challenge of serving North Carolinians both in their communities and while they may be in jail.
The biggest barrier that we face here is access. More often than not, the people we serve don't have insurance, they might not have transportation, and sometimes they might not even be fully present to know what kind of options, that there are options for another way of living your life. What I love about these initiatives is that it's bringing together all different types of lenses. To be able to have a commissioner sit there and explain his point of view, to have police officers entering in this dialogue. It gives you all the different dynamics. In the same way we want to treat a person holistically, it's treating the problem holistically as well.
It's always helpful to have friends to do work together, especially when your resources are few. Partnership is even more critical, I think, in rural areas of our state, where we have to be creative and we have to come up with new and innovative ways to approach these challenging issues that we face in our communities. It's just better together.
Miami-Dade County can chunk millions at it. We don't have those resources in our rural counties. So being able to put us all together and work, and we have some common issues, but as we've developed that, we've identified strengths in other counties, and we're able to do smaller pilots and so forth, so that we're not all in on anything as we develop our program.
Just so they know that that's an option.
It's easy to get burned out in this career, and so knowing that we're all just people trying to struggle through this, and giving them the opportunity to try again.
Learn more about NC Impact's quest to fund collaborations in action all across North Carolina. Visit unctv.org/NCImpact.